Dear ladies and dear gentlemen, dear colleagues and dear members of the Global Health Hub Germany, while people are coming in, we will already start. A warm welcome to everybody and thank you for joining our online event today on early warning alerts and response tools for neglected tropical diseases. My name is Kristina Knispel and I'm the Managing Director of the Global Health Hub Germany. The Global Health Hub Germany is a network that aims to bring together all actors interested in global health and which wants to promote exchange and cooperation across sectors and stakeholder groups, as well as to provide expertise to policymakers. The Global Health Hub Germany is a leading global health platform in Germany and representing over 1,500 diverse members from 8 different stakeholder groups, such as science, civil society, youth, international organizations, and the private sector. If you want to learn more about the Hub, please visit our website at globalhealthhub.de. Before we start with the introduction of our panelists for today, some technical information. This event is being recorded and it will be shared on the website of the Hub subsequently to the event. And I kindly ask all participants to mute your microphones and deactivate your cameras so that we can focus on the panelists. And you can participate in the discussion by posting your questions or comments in the chat. And we will discuss them later in the Q&A part of the event. Please indicate to whom your question is addressed and also indicate your name and affiliation. And you can also introduce yourself in the chat so that we have an idea who is with us today. Today's webinar is about neglected tropical diseases, a category of diseases that affect above all the poor population and disadvantaged households in low and middle income countries. Although around 7% of the world population, a seventh of the world's population is affected by NTDs, they have historically ranked very low and have almost been absent from the global health policy agenda. They gained recognition in 2015 with the Sustainable Development Goals and its target to end NTDs and waterborne diseases by 2030. Climate change and its impact have significantly influenced the spread and intensity of vector and waterborne diseases. And the disease outbreaks often happen in communities in tropical and subtropical areas and also where the health systems are often weak and overstretched. And such outbreaks are often frequently detected late and the response mechanisms are often ineffective. Against this background, I'm happy to introduce to you the Hub community on neglected tropical disease outbreak warning and response, who together with the WHO Special Program for Research Training in Tropical Diseases, WHO-TDR, have further developed the early warning, alert and response system, the EWAS tool. And the result of this cooperation has been documented in a policy brief entitled Innovation and Collaboration, the EWAS Framework for Infectious Disease, that is also available on our website of the Global Health of Germany and also will be linked in the chat. EWAS is a tool to predict imminent disease outbreaks through digital surveillance systems and weather information, and thus improve coordination among relevant stakeholders. 2 experts working on EWAS will give us a short introduction to the tool today. And I would like to warmly welcome Laith Hussain-Alkhateeb, who is a member of the Hub community on NTDs and a senior lecturer at the School of Public Health and Community Medicine at the University of Gothenburg. And also I would like to welcome Corinne, Simone, Collette, Merle from the WHO Special Program for Research and Training in Tropical Diseases, which is a global program of scientific collaboration focused on combating diseases of poverty. Welcome, Corinne and Laith. And after the presentation, we will have a panel discussion together with the 2 presenters and also with Dr. Daniel Eibach from the Division on Pandemic Prevention and One Health of the Ministry for Economic Cooperation and Development, and Christian Griebenow, member of the board of the German Network Against Neglected Tropical Diseases and Managing Director of Veterinarians Without Borders. A warm welcome to Daniel and Christian. In the panel discussion, we would like to give you an overview on Germany's engagement and approach to NTDs and further discuss the obstacles in achieving the SDG goal on NTDs by 2030. But I would now like to hand over to Laith and Corinne to present in 10 minutes the further development of the early warning, alerts and response systems. The floor is yours.
Thank you very much, Kristina. I hope you hear me well now.
Yes, we do.
Yes. Thank you very much for the introduction, for having us along here. I'd like to thank you and a colleague from the Global Health Hub in Germany. This is a really an important session and discussion, and of course a topic that we are highlighting today. Myself and the colleagues would like to summarize what we have been working with together for many years, in fact, for the past decade now, in the area of early warning and response system. And in the next slide, I would like to start with given probably just a quick snapshot of where do we stand today from the burden. So within the DNTDs, we would like to refer to vector-borne diseases as a prime topic of sort of focus area we have been working with together in this context of early warning and response system. Clearly saying from this snapshot here, we are in a great burden, and this is really covering a fairly large proportion of globally today. So more than 80% of the world's population is within this risk, specifically at least for one of these vector-borne diseases. But collectively speaking, this can really put at least half of the population at risk, looking into multiple diseases. And of course, this is not really specific to the tropical setting, which was the initial start, but can really extend to subtropical and come in fairly closer to really outside this range. Next slide, please. Here we would like to think of about the tool specifically, and if we were to start with a random search engine hit here, you would like looking for early warning and response as a topic, you could easily find 50,000, 80,000 hits in a minute appearing for you as an early warning tool or topic. But then the question is, what are these topics and what are the early warning and how they are really formulated? And these are prime question for us we have been working with. So to start off with just a snapshot here on early warning as a definition, it is actually a tool, starting off as a statistical tool in order to predict outbreaks of certain epidemics. And here we are putting these in the climate sensitive context. So diseases related and sensitive by the climate changes. And we are talking here about prediction, not detecting a particular disease. And that means we need to base this tool on certain elements or factors as what we term alarm indicators here for informing a forthcoming outbreaks. And it means we use some set of indicators to predict our diseases. We're not relying on the number of cases to tell us the information. What we have kept in mind throughout this development of this tool is the fact that this tool should not be perceived as a statistical tool merely here, but should be a framework in order to improve coordination, communication, how it can really carry forward statistical materials into an action plan in the field. So ideally, what we have kept in mind during this development is an EWAR tool that's able to empower the different levels involved in this process, the central level, Ministry of Health, as well as the local level, district, sub-district, village level, wherever the response action is taking place. And additionally, this has also taken into mind and consideration how to improve this coordination among the different level, but also the key stakeholders. So we have brought in decision making from Ministry of Health as well as district health managers, other important stakeholders like the meteorological entities, the entomological and epidemiological aspect here. They're all coming together from the IT as well to work on this tool, and that has really been the prime focus here. And of course, the idea not to keep this tool presenting certain elements, statistical feature, but it should be something easy to translate to skilled and unskilled users, which we keep in mind in that fact. Next slide, please. This is something to start with. I mean, it all starts from what we exist today as sources of information. And primarily speaking, the surveillance or disease surveillance existing in countries of which are facing these kind of burden of diseases is really the prime focus here. Disease surveillance can cover not only the scope and level of the disease numbers and distribution is capturing, but it can really also link to meteorological, epidemiological, and entomological information. So we're talking about these sort of set of information that we would like to capture. And the EWAR really should be a subset of this framework of the surveillance. So it's really a tool that should really be linked to the surveillance program. So if you think about it, what profile the capacity of the EWAR is actually the strength and the completeness and the quality of the surveillance system exists in countries. And from that, we move to the lower bottom there, where you see the table of information. These are the typical information we use for processing the early warning system. So here we look into the regional information, district information, for instance, or village level information, their population size, and we refer to the epidemiological timely information like week data arriving on weekly basis from these certain sources, number of cases. And then we attach the alarm indicators like different humidity, temperature, precipitation, outdoor temperature, and so forth as predictors. These information are uploaded by users, as you could see in the lower left-hand side, and then they get instant appearance of how the model is really progressing here. It is a fairly easy approach for them to handle, so they're looking into the sensitivity, how this really able to predict, and of course the higher the sensitivity, the better the model at predicting of diseases. And the positive predictive value, the PP value, is basically outlining the alarm, the false alarm. So the higher, the better. And it really gives them an indication of what is predicted as a case number. So they can really tell in advance, weeks ahead, what is the likelihood of having case number appearing per population. Next slide, please. Then moving from this sort of center level prediction development into the local level. And this tool is usually linked digitally via the national server. And that's what we have been working with countries. So they have an existing server which can really accommodate both what is really happening at the central level, and then how here district level and a field worker can really observe as a really straightforward snapshot of what is happening and what is the likelihood of having an outbreak. So they could see on a stage-wise response what is likely to happen in a forthcoming period, whether they should remain and maintain their protocol as a routine response, which is no response, or they should really scale up to take into account there is a warning happening in the next forthcoming week. So from that, we have aligned this what exists as a protocol, but also to structure it in a way that it really follows what really likely to happen in the next period. And of course, they could move from time factor to space. So they have a hotspot where they should start the response from by the risk mapping produced from the map here, which is also part of the EWAR. So far, I must say just quickly that this tool has been focusing on tropical epidemic diseases and usually focusing on areas where there is an existing vector-borne response mechanism. I hand over to my colleague Corinne, please, for the next slide.
Thank you. Next slide. So yes, so it looks a bit complex, but actually in practice, when it's set up and the modelization is done and the cut point is defined and the district level can use it, we find that it's quite easy to be used and to act on. So here we wanted to present you a map where EWARS is either exercised, so the country are building their model, or implemented. And a couple of documents on the right-hand side that help the country as well to use this tool with a policy brief that was recently written. So 17 countries so far are using this tool. You see there are just a few countries in Africa because of the availability of the data set that you need at the start to build your model that is less available in this region compared to what's happening in Asia and Latin America. Next slide. Next slide, please. Yeah, So just to also mention to you that what we want is that this tool trigger action, and that's what we want to also show. So it has been shown in Mexico already. They looked at the use of the tool and the decrease of the improvement in terms of vector control. But now we have a couple of countries, 4 countries in different continents, who are trying to evaluate what is the impact of using this tool on vector control, with 20 districts in each country who are involved in the study, with 10 intervention, 10 control, and the idea is to look at the impact in terms of vector control activity, and show that when the EWAS is in place at a peripheral level, then it makes a difference in terms of vector control. So the result of this study should be available in 1 year time, roughly. I think that's it. It's our last slide. The last one was just to thank you again for inviting us to present this tool, and that's it. Thank you.
Thank you very much, Laith and Corinne, for the presentation of the EWAS tool. We've learned how EWAS can help to detect disease outbreaks faster, and that can in the end also help to save lives. A quick reminder to the audience, you can participate in the discussion by posting questions or comments in the chat. Please indicate to whom the question is addressed and also introduce yourself. I would now like to welcome Dr. Eibach and Christian Griebenow on our virtual panel and start with my first set of questions. Corinne, you neglected tropical diseases. Yes, it's a diverse group of about 20 conditions that are mainly prevalent in tropical areas. We know that, and that mostly affect marginalized communities. And disproportionately affect women and children. What makes their control and elimination in the end, and also eradication, so challenging for public health?
Thank you. It's not an easy question. No? Actually, you're right. There is a range of diverse disease that can cause illness and hamper economic development in poor population. There have been some progress that have been done. For example, on African sleeping sickness, there have been a drastic reduction that has been reported, but there are other diseases that the progress are less impressive. For example, elimination of schistosomiasis has been really challenging in Africa region. I would say that there are many factors. First, what we see is that NTD are really increasing mainly in rural area, conflict zone, hard to reach population. They are really most prevalent in areas where access to clean water, sanitation is scarce. And of course, all is worsened by climate change and urbanization. So that is really the context, the environmental context that makes this disease and some of the disease very prevalent. Then there are also the quality of the healthcare that is a problem, because NTD tend to affect regions without quality of care, where the living population has less access to the new medicine, diagnostic, probably innovative technology that we need, that are also needing to be developed to really reach the ambitious target. And the major challenge would be to really ensure the equitable access to treatment for NTD. And finally, I would like to highlight that as a program is shifting towards elimination, the surveillance, good data system, and the adequate response are needed to sustain the gain and avoid the resurgence of disease. So these are, I think, the range of challenge that I wanted to flag. Thank you.
Thank you very much. Yes, the challenges definitely are also going beyond the public health sector, which of course makes it even more difficult and requires intersectoral cooperation. I would like to ask the participants to switch off their cameras so that we can have the focus on the panelists if possible. Yes, there's a new participant who just joined. Maybe you can switch off the camera as well. Lukasa. Coming to you, Daniel Eibach. As we've already heard, NTDs have been historically ranked very low on the international agenda, And then with the introduction of the SDGs and also the specific target to eliminate NTDs, there has come another different kind of attention. Then, in beginning of this year, Germany was among the first countries to sign the Kigali Declaration, a commitment of partner countries and other key stakeholders to implement the WHO roadmap to end NTDs by 2030. Could you give us an overview on Germany's engagement and approach to ending NTDs? Where do you start?
Yes, thank you very much. Yeah, you're right. Historically, NTDs really have ranked quite low on the political agenda. But I just looked it up. I think we supported TDR since 1974 already. So thank you to the TDR colleagues for giving us insight to your work, and really nice presentation and really great project. And I think we also have to thank the very active and committed NTD community, like across all the sectors, from civil society, in academia, private sector, but also within international organizations, which made it possible that NTDs are actually now on the political agenda and are much more present. So thanks a lot for this. And I'm also very pleased that NTDs are part of the coalition agreement of the German government, and that Germany was one of the first countries to sign the Kigali Declaration. And I think during the pandemic, this was quite a clear sign that NTDs are not completely forgotten, although we had worldwide challenges due to Corona. Of course, those last 2 years were really overshadowed by the Corona pandemic, and there was a focus on pandemic preparedness and response. And but I think on the other side, this wide attention, political attention, but also public attention on those different health threats could be also very beneficial for NTDs on the long run. I think, for instance, at our ministry here, pandemic prevention and NTDs are placed in the same division. So there's really no need to compete for any funds, but there's rather a common interest and a common lesson we have learned from the pandemic, that there's really the need to strengthen health systems. And I think this is the direction in which the BMZ NTD engagement has evolved. So we are coming from rather horizontal disease-focused programs like onchocerciasis program, and we're now moving really to a more holistic approach. And I think this is very much in line also with the WHO roadmaps on NTDs. So just let me give one example. Since the Ebola epidemic in West Africa 2014, I think we support the ECOWAS region, West Africa, like with strengthening of laboratory networks and diagnostic capacities on the national level, but also on a regional level. And we work very much on sharing surveillance data across those laboratories, but also across national and regional public health institutes. And this has been set up for control and spread of hemorrhagic fevers, but the health system in general has profited from it. And we have seen this during the pandemic, that laboratories which were set up could actually do diagnostics for SARS-CoV-2 as well. And the surveillance could be used for the coronavirus as well. And I think the same way other diseases such as NTDs will profit from those systemic approach as well. And I think what we have just heard in the Ebola presentation, I cannot agree more. That's how crucial it is to have reliable and good quality data. And I think we are able to use this data for a lot of different things. One thing, of course, that's just presented is early warning, but we can also plan vaccination campaigns according to those data. We can use it for mass drug administration, targeting different populations, but also for other public health measures. And one important last thing I want to mention is that we should also not forget another very urgent health threat, which is antimicrobial resistance, where we could also use this surveillance data, and we need proper surveillance and proper laboratories and good quality data to intervene there. So thank you very much.
Thank you, Daniel. Yes, I think what I hear is the NTDs are important. There is more attention to it also in the new government, but also I hear a lot the system strengthening approach is important, that we can benefit from pandemic preparedness, NTD response surveillance and data in many different ways in the end to come up with health systems that can address all the different challenges and including NTDs. And that this is where the ministry is also laying a focal point and having a focal point. I would like to come to Christian Griebenow and the German network against NTDs, which is one of the key players also in the German landscape with regards to raising attention and informing about the relevance of NTDs. The German NTD network was established 2014 and forms a national platform in Germany. And Christian, can you give us an overview on your biggest achievements since the establishment, and also what has maybe changed globally with regards to NTDs and also with regards to the approach that the network is taking?
Yeah, thank you, Kristina. For sure. Yeah, the network was founded 2014, and I think what was the first really good thing when we agreed, the organization who founded it, was bringing together, following the London Declaration for NTDs, which was before the Kigali Declaration, bringing together NGOs, pharmaceutical companies, tropical medicine, with regard to veterinarians and human medicine, and also for sure the science institutions we have in Germany, which are very important even over the borders of Germany. And this, I think, was a very, very interesting move, finding common ground, working together, and try to provide a ground where politics are able to convince to invest more from Germany, but also globally in fighting NTDs. And for that one, it was really good not only to have the implementers like us as the NGO. I'm also chairman, the managing director of Veterinarians Without Borders. It was very good also to get produced evidence by scientists how we can fight the NTDs. And I think in the very first beginning, we had like one paper where we show we have the 20 NTDs targeted by WHO and what we have achieved, where we are standing, because somehow it was not really clear. And if you want to make an argument for fighting NTDs, you need to be also clear on what NTDs are almost over. We have leprosis, for example, river blindness, where we have big achievements, but we have others like Chagas or Chisto, which are a long ways to go. And I think in the approach then, as the network, we succeeded in 2015 and 17 to get it in the agenda of the G7, which was not before. So this was a really hard fight for the network. If you look now for the Kigali Declaration, so there is high-level declaration signing authority also from the BMZ and the German government by this one. This was not when we discussed the London Declaration, and I think what we all agree is in this network. The One Health approach for us as a veterinarian organization is very important, and even in 2014, even if we don't name it the One Health approach, I think we followed this as a network, bringing together really holistic way different aspects, and I think that is what make us so strong. We are not so many people; it's like 35 members, and we are a board out of five persons who doing that voluntary. But I think looking now to the presidency of the G7 2022 by Germany, I think there are some promising lights. We have the coalition agreement of the German government from last year, where the NTDs and the One Health is named. So this is not the case in all Western countries, I would say. So this is something where I think it is really something where we as networks and other contributors succeeded. And I would say globally, there's a way to go. we have the Global Fund, and we're discussing about NTDs and the Global Fund for years now. And for us, it's very clear we need the mandate in the Global Fund also to addressing especially the NTDs, especially because they are not so easy to target. We have diseases like tuberculosis and others which are easily in the diagnostics. Some of the NTDs are, but we all know that some of them are not. So this is something we are in discussions. We have Aspen in the WHO, which Germany also agreed to substantially fund with some money a year. I think 3-4 million a year we're giving for the eradication WHO program against NTDs, Aspen. So this is something I think which is going in the right direction. But therefore we address like 3 or 4 NTDs. Even the 20 are not all NTDs which we are having in the WHO. Though there are others, even upcoming diseases where we easily could discuss and agree that these are neglected tropical diseases which are not within the 20. So there's a long way to go, but I would say is some programs I see in the last years, I see in development, which is quite positive. I see in awareness, not only in the German governments, also in the countries, in the governments, in the domestic countries, which are very important that we have that awareness there, because even if the money is secured in other ways of funding, it's very important that you have the government of the domestic countries where we have most of the entities and the highest prevalence, that they are in line with the programs which are coming by national, by other states or the WHO.
Thank you very much, Christian. And I see Laith already nodding. Yes, so yes, I think the network has, as I heard, the network has achieved quite some successes. Obviously, probably not only by the network, but NTDs are more prominently addressed now, and this has to continue. Yes, and also, of course, there is still a long way to go. Laith, I would like to come back a bit on the EWAS tool. We have seen that it's an information system designed to support decision-making for national and local level institutions, and also enabling vulnerable groups at the same time to take action to mitigate the impacts of impeding risk. Like, can you give us another example of how this works in practice, and also maybe again elaborate a bit more why this is so relevant, especially for NTDs?
Yeah, thank you very much, Kristina, for this important question. Fully agree. I think we could start with the fact that we could think of NTDs are being responsible for significant hospitalization and absenteeism from work and school today. I mean, thinking about dengue itself, it is really affecting more than 500 people within the tropical setting, 500 million people. So it's a significant number are being at risk here. And if you think about the regional coverage here, are primarily the vulnerable group and vulnerable societies sitting there within where already overstretched health system exists in there with other diseases. So definitely this impacts the public economics for sure, as well as the household economic. And there are some consequences in that. I mean, this can be definitely looked at as disastrous for society when it comes to this particular impact in terms of hospitalization, dismissal of work and school and everything on fairly regular basis. I mean, this is quite seasonal. I mean, that's kind of frequent pattern we see here. What we think of as EWARS, early warning system, I mean, I'm thinking here about diseases that there is no effective vaccine exists today for them. So that's really the case for most of the vector-borne diseases, at least within the NTDs. EWAR should be looked at as a framework or an opportunity where we can buy more time for adequate and timely and space-wise response. I mean, if you think about it, there is today existing response in these countries where the burden exists. There is a field workers. There is teams existing. The question is when and how to be more adequate and where. So this is really the job of EWAR, where it can really guide more efficiently and effectively, hopefully, if we have some more studies in the future, to really look into how effective the team in field really respond on time and in space matter. This is really the concept of EWAR. So there is no effective vaccine. There is really a burden. We need to be ahead of time. And that's really a question of course, of data availability and everything. But we have, from Corinne, what she presented with these countries, it's a really good number of countries within this hotspot, and they have shown really successful stories. I present, for instance, the story from Mexico has been fairly recently published now, where this tool has been implemented for the past years now, within a recent trial where they looked into district which had adequately complied and responded on time and space based on the alarm signals received from the EWAR, how they have managed to avert and mitigate outbreak, unwanted event in these districts. Whereas on the other arm, where we had a district who failed to comply with the EWAR signals on time, they clearly showed increased burden and outbreak happen in their district over a period of years. So it's really a fairly clear evidence that complying with this EWAR in time really has advantages. What we really want to continue developing in the future is really some robust design in assessing this. And I think that's what my colleague just been also saying here, and what Corinne has presented in the last slide. This is really a very important next step, I think, for us. How can we really show evidence, adequate evidence today, which is really lacking? If you look into the literature, there isn't existing studies with robust design to look into how early warning could really mitigate. Even though we know that from the field, we need to show that, because there's a cost and there's an effect together, and that's really missing. I'll stop here. Thank you.
Thank you, Laith. That sounds as if this is the next step that you would like to take with EWARs, going into the direction of evidence-based and operational research to show its effects. I would now like to come to the questions that we have already received from the audience. The first one I would like to address to Corinne and Laith, maybe one of you. Deepa Pindolia from Clinton Health Access Initiative, who are also supporting across Africa, again, the fight against malaria and DNTDs. What steps are being taken, and what best practices do you know that ensure that EWARs are is being used by country governments for strategic planning and implementation? And what are some key learnings? I don't know, Corinne, do you want to start or? Yeah.
I can start. Thank you very much. That's exactly the problem. The tool is very pleasant when you discuss with the disease surveillance people. They are very attracted by putting together all the numbers and developing this model, but that's not enough. What we want is that this model is then used at peripheral level by district. So you need to train staff on the use of EWARs. So there is a step there where it's quite simple. It's an alarm that is appearing when you go, when there is the risk is higher. So that is quite easy for the peripheral level, but you need to do it. And that's not enough, because in some country, the disease surveillance people are not the one who are in charge of the vector control response. So you need to have, from the start, a good collaboration between the disease surveillance system and people and the vector control response people to really act on the alarm. And if that is not done, then the tool is useless. And to feed the tool as well, you need to have on a timely basis meteorological data. So you need also a link between the disease surveillance system and the department in charge of meteorological data collection. So you see how it's easy, but it's not easy, because you need to have people working together. And the last point I wanted to make, because we spoke about this alarm system and all those things, but there is also in the EWARs risk mapping. So you can know in an area that there are more risk of outbreak. And then I would like to come back on what Christian was mentioning on the One Health approach, because that is also a tool, this risk mapping, that can be taken by the Ministry of Health to try to work with the environment and other partners to also minimize the risk in this region, you see. So there's also this aspect that EWAS can help to. So in conclusion, there are many steps, but our experience show that it can go very quick. In Thailand, currently, they have been very quick in taking this tool, in sharing in training the peripheral level, in getting meteorological data, in including it in their surveillance system. They have been very quick. When there is a willingness, because of the threat, perhaps, then there is action, and that's the lessons learned. Of course, it doesn't work everywhere like that. So that's where also TDR and colleagues, we are supporting the country to try to find solution. Over to you.
Great. Yes, thank you very much. Yes, so it is complicated, but it's feasible and it takes political will. Okay, that probably applies to many things, but here we have already concrete steps laid out. Maybe, Laith, if you want to also react to that question, I will take up another question by Joachim Unger, CEO of Global EMS. Then maybe I would say relates to this, because he is asking, how do you assure adequate response on early warning? I think that goes into a similar direction. You have the information, but how do you get the response and the action?
Yeah, thank you very much. I think that's a really good question, to be honest. It's really a pending issue today, because we talked a lot about EWAR as a tool, but how the response is really measured. And I think there are many ways of doing it and nothing easy today. But I would start with, of course, thinking about many aspects. But what we need to keep in mind is how can we be a little bit efficient? So the idea is not to make comprehensive too much of burden as work, because it's all about data collection. It's all about how you can organize these information coming before and after response have been taken away. Some countries have really advanced surveillance system where they can really capture these in a really organized ways. Other surveillance systems are really much poorer, and they lack such organization in sense of data. How you know about an adequate response? Simply by measuring and assessing your information, your data. You can look clearly. That's what we did with, for instance, Mexico and other countries. We looked at how the coverage of household as a response, how the frequency of response to a certain region, so in terms of intensity, coverage, and frequency, had really showed a reduction in unwanted outbreak as an outcome or not. But they had the data available. So I would definitely think data capture is a very important thing for assessing your work. Second, I think the element Corinne just mentioned in terms of risk mapping, this is really a lack today. This is really a gap today. If you think about what exists today, what is really being used or not even implemented, but at least exercised in countries, it is outside any risk mapping component. So the question is, where can they take action? If you take a district of 1 million population and there's an outbreak happening 8 weeks from today, where do I take action today? It doesn't make sense. So you need to have quite a concrete spot to start off on. And there is what really ensure adequate response per se. So risk mapping is really one thing that countries need to consider. And that means they should really encourage them to also think about data collection much wiser than what really existed, because really it's an efficient approach for ensuring high quality response in the future. So in conclusion, I would say organizing data collection in a really good, adequate way that's really can be quite cost effective here, and also utilizing tools which provide such risk mapping approach, which are really adequate and useful for effective response. Thank you.
Thank you very much, Laith. We have a few more questions, and I would like you to change the order a bit. We have a question from Thomas Clemens from HAW from Hamburg. I would like to direct that question, although he indicated it to go to Daniel Eibach in Laith. I would like to direct it to Christian Griebenow, because also in the German network for NTDs, we have the a variety of stakeholders coming together. And I will give Daniel Eibach later the opportunity also to reflect on that question when I come with the next one. Thomas Clement is asking, could you share some experience about working with stakeholders here in that context of fighting NTDs? He's particularly interested in how to transfer scientific findings into policy recommendations. And I understand the DNTD network is exactly trying to also work on that area. Christian, would you like to respond?
I will try to. Maybe a first comment in the beginning. Due to COVID-19, not only veterinarians talking about One Health and integrated approaches. I think when we look to scientific research, this is you cannot do scientific research in many infectious diseases in other parts without One Health. So this is a standard since many years. But when it comes to implementation, it's a long way to go. I would say, and there are not many One Health projects at the moment. And one aspect of these, that's why I try to use that vocabulary, is for me the One Health is not only different sectors. It's always a layer between implementation and science. And every sector, may it be veterinarian, human, engineer, whatever, have also a science layer. Down or under or above, how you want to see it, it's depending. And the question here is, I think, if these layers are working together. So for us as a veterinarian organization, it's easy to integrate veterinarian recommendations, find it, or even with the human medicine. I think there's a way of same language, I would say, and that can lead to economic advantages, like using the same cooling chains, which is a very easy thing, and which in many entities, especially if you use vaccines, is something which you can address. Other things are, could I use the same medicine for the same animal and the dog at the same time? So, for example, I easily can deworm a dog and using the rabies vaccination in the same second. This is not. There's no issue. It would be better if you do it like 2 weeks before the deworming, but if you don't have the possibility, it's better to do it this way than leave the deworming out. By this, you combine echinococcosis and rabies in one thing. So I think it's easier if the scientists and the implementers are coming from the same planet, I would say. And I think in other ways we might have even problems with the interfaces. And I think that is a species which in our society in many ways appears. So people who are explaining, translating from the experts to the men who are maybe on the women on the ground, I think, there I see the most challenges. So sometimes you have recommendations, and it's not they're coming from different backgrounds, and then it's maybe not easy in the first place to integrate them, or even there are other aspects which are speaking against a bit. But it's always good to have them, and with the Global Health Hub, we have the possibility bringing all these things together, or as we do in the NTD network, and deciding then, is this understandable? Is this relevant? And is this something which has really an added value? And I think that is coming from the One Health approach. Who also know the added value is even something which I think is the most relevant category, where you can decide, yes, this is something which we should integrate, or this is something where we do another search of another round of research. Thank you.
Thank you very much, Christian. Yes, I think like translating the scientific findings into feasible recommendations that are fitting to the needs of the policymakers is definitely a continuing needs work, and is of course also on the agenda of many people. Daniel Eibach, you can maybe also respond to that question with the scientific findings and how it can be translated to policy recommendations from the political side. But I would like to add the questions that has been asked by Jan Thilo Klimitsch from the Christopher Blind CBM office in Berlin. What prospects do you see for integrating the NTD control and comorbidities into the mandate of the Global Fund to fight AIDS, TB, malaria?
Okay, yeah, thank you. Yeah, that's a good question on the Global Fund, and as already Christian mentioned before, it's been discussed for quite a while, and I fear I'm probably don't have a satisfying answer to this, but of course we are of course in very close contact to the Global Fund, and because we are sitting in the board, and we are able to initiate ideas and raise our thoughts, and this is what we did with One Health, for example, during the last years. Last year we initiated a study on One Health and how we can actually integrate One Health aspect or the One Health approach in the activities of the Global Fund, and I think this has been received quite well, and there are initiatives going on in this direction. But of course, this is still focusing then on malaria, tuberculosis, and HIV, and not NTDs. This is clear. Another initiative is to, and this is also now written down in the new strategy of the Global Fund, is to include pandemic prevention in the Global Fund, because I think the Global Fund also realized that a pandemic can be quite a challenge for their program on for those 3 diseases. So I think the Global Fund is also thinking a lot about health system strengthening, and to keep up their programs, and so I think this might be approach how to include NTDs as well. Yeah, I'm also referring to the first question. I think if you're able to strengthen the health system in the right way, I think entities are able to benefit from this. I think this is where we have might have a window of opportunities to include entities in the Global Fund. Although of course the mandate is still the mandate as it is on TB, malaria, and HIV, and it's not changing at the moment. It does not include entities. Maybe on the other question on stakeholders and implementation research, yeah, I think, yeah, very, very interesting question, but also very difficult in reality. I think we need to invest in implementation research. I think this is, we in the ministry benefit a lot from this. I think I personally come from research. I'm BMZ since 1.5 years, so I know that it's not easy to directly transfer scientific results into a certain policy. You need very, very, very good arguments, and you need to, as Christian said, you need to demonstrate the added value. And I think implementation research, proper implementation research, can help a lot to make a point, also towards politicians in the end, to have good arguments in our hands. So I would welcome every implementation research project very much, and happy to hear any results on good implementation research projects, and to put this forward also to into policies finally.
Thank you. Yes, so there was the invitation to share results from implementation research with you. I think that will probably be taken up. We have more questions from the audience, but I would go back a little bit to the panelists with a small set of questions that I have prepared. Daniel Eibach, we were talking about the One Health approach, and last year the BMZ published its strategy on One Health. and listed NTDs as a core problem to be addressed by the One Health approach in that strategy. Looking a bit at maybe the bilateral cooperation as well, how does the BMZ and its partner foster the synergies for the One Health approach and also in the same time addressing NTDs in the health programs?
Yeah, thank you. Yeah, I think the One Health strategy, which was published last year, I think it has a very strong focus on infectious diseases, on zoonotic infections, NTDs, and also AMR. Those are the main pillars of our strategy. And as you already heard that now from me, as we don't think too much in disease-specific programs, I think it's not always a question for us how we can include One Health or the One Health approach into a NTD program, but it's quite often the other way around. How can we include activities which are relevant for the fight against NTDs into the different sectors, into the different other activities? For example, Global Fund. But I'll give you also other examples. For example, we are supporting a number of projects on sanitation facilities, for example, and this is really relevant for a number of entities, and we address the correct vulnerable groups in certain hotspots. And this has been quite successfully implemented through the Fit for School program, for example, where we provide access to sanitation facilities and clean water in schools in Southeast Asia. And another example is surveillance. I think new surveillance approaches are right now one of the key topics in the German G7 presidency. And there's currently a lot of discussions on integrated surveillance strategies for AMR, but also a discussion on wastewater surveillance for SARS-CoV-2 for sure. And what we need to discuss in the NTD community is how we can integrate certain NTDs into those integrated surveillance programs. And how is there any NTD which might profit from wastewater surveillance, or can we include metagenomic data from different vectors into those surveillance systems? Rather integrate NTDs into those discussions. And last but not least, another hot topic, vaccination campaigns. And I also agree with Christian here. I think I have the impression that the human veterinary sector could work much closer together and create synergies in this respect when it comes to vaccines. I think we have just started a project in Cameroon and Namibia where we combine vaccinations against animal diseases like Newcastle disease, PPR, goat plague, which are diseases which are economically very relevant for the livestock sector. And we combine it with vaccines against rabies, which are rather relevant for human health, but economically not so interesting for the animal sector. So, but there are a lot of synergies. We don't need veterinary teams or human medical public health teams to go into the same villages and do their vaccinations in parallel, or do information campaigns on those diseases in parallel. I think there's a lot of need for infrastructure and awareness building, what we can do together. And I think this is an important direction to go. And I think in summary, One Health, it's still a lot talked about, but implementation is quite in the beginning still. I think there needs to be still much closer contact with the other One Health disciplines. We need to learn about other programs and each other priorities. It sounds very trivial, but it is not. I think we have to leave our comfort zone a bit, and this might involve a medical doctor really attending a WASH conference and not just attending an annual meeting of your own specialty society and discuss internally how to include One Health in this field without having anybody external expert present. I think we have to go out and talk to the other disciplines. I think it's crucial. Thank you.
Absolutely. Someone said, if it doesn't hurt, it's no real cooperation. So yes, we have to go out and leave the comfort zone, as you said, to really cooperate across sectors, and particularly in the One Health approach. We've been speaking about the One Health approach. I would like, again, look a bit at the pandemic as well, the COVID-19 pandemic. Christian, the COVID-19 pandemic has been a powerful argument in the last years for this more holistic approach of human and health and animal health and ecosystem. From your perspective, what are there other areas where the fight against NTDs could profit from the fight against COVID-19, or where lessons learned could be applied from the fight in the pandemic? Or on the other side, maybe, where the areas where the COVID-19 pandemic has deepened the neglect of NTDs?
Yes, thank you for that question. I like to answer it with two ways, maybe. Though, first of all, it's amazing how fast we are able to get a vaccine. Coming from Germany, developed very fast track, and I think it was, even compared with other vaccines, coverage and other things, it's quite a success. If we look to NTDs, it takes sometimes much more time there to develop new vaccines and medication, because there's not so much money in it, there's not so much interest in it. And for example, now we have a quite successful medicine against schistosomiasis, Prazenquatil, and now I think it takes some time to get a formula which is useful for children. And now we're talking about the financing, but we already have the medicine, and it was only about a discussion about getting it, which was complicated. I would not doubt that one. And Merck invested a lot of money there. So I think compared these tracks of pandemic situation, every money, every attention is going there, and the other side of the medal, and it's quite opposite, we have the neglected tropical diseases, which we come from the word are neglected. That's maybe one part of the answer. And the other one, I could not spare that out. I would say in the endemic countries of NTDs, the fighting against COVID was not really a strategic success. I would say it. I can say it from Eastern Africa. The vaccination coverage is quite low, which has many reasons. Also, the fact that the vaccines in the critical months were more available in the northern countries in the world and not so much in Eastern Africa, I would say. And if they was available, then more the types that are left out in our storages. For example, BioNTech and others, which are also highlighted here, are not so much available in the countries. And there are other factors, skepticism and other things. So I think what we can still learn out of that one, because if we want to fight entities, and that is something which was also part for the COVID-19, or is a part of COVID-19, for example, Eastern Africa, we are present. It's about acceptance. It's about awareness creating in the minds of the people, and it's also about benefits. So I think we need to address really this issue of communication, and this is not only a side effect of fighting entities. Communication is really a sector of its own. So if you want to convince people here for investing money, but you also need to convince people to take a vaccine, take a medicine, and a vaccine is one shot. A medicine, sometimes you have frequently to take it again and again and again. So therefore, you need an awareness, you need an acceptance, and you need infrastructure. And I think awareness and also the cure of the acceptance, that was also something which we missed in the communication with COVID-19, especially in the Eastern African countries. And so this is something I think where we can learn out of that one, that this is for entities, fighting entities, very important. Very shortly, COVID-19 make a big gap in fighting entities globally, that I would say. So many medicine don't pass the last mile. We had, I know it from pharmaceutical companies who really had the medicine storage in some havens because there was no logistics, there was no outreach in the countries in this time. So this, I think, we are still in observing how big the damage is, because you need permanently, from some of the diseases, permanently actions to bring them down. So if you have like 1 or 2 years where it stuck, it bring you back more than 1 or 2 years in the eradication process of NTDs. For some of the NTDs, I see that with rabies vaccination, for example, this was ongoing in the rural areas. So it was not for all, but I think for some of the NTDs, we are, yeah, it's quite a loss in time and they are for fighting them. Thank you.
Thank you very much. I would now like to go back to the questions from the audience. We have, on the one hand, we have one recommendation, one example of research that has been conducted on NTDs that has been shared by Angela Schuck from GIZ, supported by BMZ on the One Health Center in Africa, International Livestock Research Institute. Maybe you, if you're interested, check out the link that she has shared. And the next question, we have several questions that are looking at this question: how is the EWAS tool, and this is why I'm coming back to Corinne and Laith, how it is integrated with other surveillance systems, and another question that is looking at that nexus question, or again linking the system with others and also other sectors. Corinne or Laith, I'm not sure who would like to answer the question from Annette Hornung. Are there other surveillance systems with which the EWAS is in contact, and are they being harmonized? Who can respond? Laith, can you respond to that one, or other for Corinne?
Just to hear the question clearly, are there any other existing EWAR you mean today? So
other surveillance systems that EWAS is in contact and that it is being harmonized with?
Absolutely. So if I put this in our EWAR here, that where we have presented, there are countries who have actually taken this completely within their national program, like Mexico, for instance, who has been for some time already now in the marketplace. They have over 137 districts national-wise, and this tool has actually covered the entire national level, and they're all centralized by the Ministry of Health. Harmonized with their national program, and in fact has been also translated into Spanish, so it is completely in the hand of the vector-borne national program there. Definitely this is underway as well in other countries. Today we see Thailand, what Corinne just mentioned, they have actually took this on board. They have in fact benefited from these experiences. They went on purchasing a new meteorological station just for the purpose of aligning this at the national scale. They are currently piloting this in over 20 districts, and they are implementing this at a national level platform. This is also happening elsewhere, like in Colombia today is underway as well, taking advantage from this experience. So yes, for sure. I must also say that generally speaking, EWAR has been, this is one of the gaps today. I mean, we have also published among our group here a fairly recent systematic review which declared that EWAR exists as a tool, but is barely and rarely implemented. And that's something that we have kept in mind today, because there isn't any usefulness of having a tool to be exercised with data, but it should really be trialed, because it's not only one element. You need to know how this is really sort of being captured in terms of statistical analysis, in terms of data arrival, when data will come in, what users can really do, how they can take action. So you need to involve everyone in this process. It doesn't make sense that you have a tool existing in one office testing it with the data. And that's really a gap today. And that's what we have made sure to emphasize in our EWAR as a next phase now. So we have advanced with the tool itself, but more of the implementation now. I think that's what Corinne has mentioned in her most recent slide as well. I don't know if Corinne would like to add anything here, but for me, this is really what I could mention as example.
Just on the integration of this system within other surveillance systems, and I just wanted to flag that the surveillance system is a disease surveillance system. So, and that's true that some country can use if a disease surveillance system is robust, then you can follow the increase in your in the incidence of whatever disease, and then you can perhaps react. But it might be too late. And the particularity of the EWARS is that it's predicting the outbreak by using climate data. So it's a tool that comes on top of the surveillance system, the disease surveillance system. So the integration is not like when we think, oh, is it another system, parallel system? No, it comes on top of the system. Of course, there are some countries who are using the HES2, for example, for their surveillance system. And we started to think, could we link the EWARS tool with the HES2 and have everything on the same dashboard, for example? So that is something we haven't moved forward, but that could be the vision we could have for the department who has the disease surveillance system, also having the EWARS integrated. If you use the data from the HES2, meteorological data and disease data, for example, this is a way to move forward in the future. But this tool come on top, just to clarify that. Yeah.
Thank you very much, Corinne. Very helpful. We have a question from Jantilo Klimisch, another one, that is asking what role can the new WHO data hub in Berlin play in this whole context? But I'm not sure who exactly of you could help to answer this question. Corinne, working at WHO, is there a link already, or is this something that that is at least on your mind, exploring the cooperation with the data hub in Berlin?
I'm at the WHO, but the WHO is a big family, and I'm not sure I'm the most relevant person to discuss about this link. But it's a fantastic initiative, this in Berlin, and I'm not sure that for the moment for the EWARS we haven't explored at all the link, but that will come probably. I have the impression that this hub is now setting up. So let's see what are the opportunity in the future. But that's fantastic that this does exist, and that we flag the importance of having a data that is in one place and that can be used by the others. So I cannot say so much more about that. Yeah.
Yes.
I could just say a quick thing here. I don't know. I got the impression that this hub is mainly stemmed from the COVID area, or actually focus on that particular. And I think we could bring in the surveillance factor here back on the spot. I think that's what our colleague Daniel has mentioned previously as well as data. Today we learned in this global health context where we are today, from COVID time at least, we learned how weak we can be when it comes to data. And this is regardless where you are. I mean, even Europe have suffered from poor surveillance, I must say. So I think this hub has a great potential in enhancing the surveillance across Europe and within Europe. We don't have really concrete plan on this yet. There isn't concrete element, and hub exists to unify European countries. I mean, talking about DNTDs, of course, there's risk that we haven't received a disease coming upwards now to Europe. We learned from the COVID, we were poorer than many other countries, which are a much poorer country economically. They have much more advanced surveillance. They learned from history. Think about Sri Lanka, for instance. They are really advanced in surveillance since the 50s. They are handling this, and we are not there. So I think this hub has great potential, I think, pulling us together.
Maybe I can add something, because we have been in contact with the hub here in Berlin, and had very, very good talks with. And yeah, I think the hub is just setting up and developing right now. But yes, I think it's a very good initiative, and has a potential when it comes to surveillance systems. And I think when we just talked about integration and different surveillance systems maybe running in parallel or on top of each other or things like that, I think there is room for standardization and harmonization of data, and for improving data quality, especially in the countries where we work in our global south. I think if we want to do proper early warning or predictions or modeling, and I think we saw that in COVID pandemic, I think on the basis we need good quality data, and to set standards, I think such a could be very beneficial.
Thank you very much. Yes. I would like to take the last question from the audience, and then we will probably slowly come already to the closing. The last question is from Jani Müller from the University of Pretoria in South Africa. She would like Daniel Eibach to answer this question, but I think maybe others who would like to contribute can also come in. She is interested to know, how effectively are digital health technologies being used for management and treatment of NTDs? And what kind of support are the countries receiving in this regard, the aspect of digital health related to NTDs, is it here?
I think when it comes to NTDs, it's not so easy to say, but in general, of course, I think we are investing. We try to invest quite a lot in digital tools. So when it comes to surveillance, I think what we set up already during the Ebola pandemic was the SORMA system which was piloted in Nigeria originally, and now it's rolled out in the whole country, and it's also rolled out in Ghana and used for different infectious diseases, not just Ebola. I don't know whether there's any NTD among them. Probably not, I would think. But still, now it's actually, the SORMA system is even used in European countries like in Germany and France, with a lot of challenges still. But still, I think that's also a success story, how a digital tool can be developed in the global south, in sub-Saharan Africa, and now used in Europe. So I think that was a great investment. And
we just learned from the audience, it does include NTDs. We have an expert with SORMAs also in the audience.
Perfect.
Great. We have also two other I think one or two information from the chat that I will also like to share. Frederick Selig shared that WHO has also launched a cross-departmental initiative called the Global Arbovirus Initiative, and he shared the link to this. And we also, since we raised the question about the WHO hub in Berlin, just 2 weeks ago, we had an interview, an expert dialogue between Johanna Hanefeld and Dr. Chikwe, also here in the Global Health of Germany, and you can access the recording also via the link shared in the chat. So now the last question to the panelists. I would like to hear from you. What is your own take-home message, or what is the take-home message that you would like to share, or to the audience to take home? I would like to start with Corinne, and then, yes.
Thank you. So I think that I hope what we explain, that there are threats, increasing threats because of climate change, urbanization, and there are some country or region, such as Africa, for example, where we are conducting a survey to assess the capacity of the country to for the surveillance, vector control, and even outbreak response to vector-borne disease. This survey showed us how weak the system is in Africa compared to what we have in Asia and in Latin America. So there is really a need here to strengthen country capacity, and that's I would echo the the comment of the colleagues and Lina about the Global Arbovial Initiative. That is really a chance that WHO launched this Global Arbovial Initiative, because really there is a strategic plan that really aims to tackle emerging and re-emerging arbovial disease. And there are different pillars for monitoring the risk, pandemic prevention, preparedness, detection, response, and building a coalition of partners. Just to flag that EWARS fit very well in this initiative, because it answers to the capacity of the country to have an early warning system, so detecting earlier the epidemic, the outbreak, so that where the EWARS stand, and hopefully there will be more and more appetite for this type of tool. But like we said, a tool is a tool. If you don't have a system in place, then the tool is useless. So there is also a need to strengthen the capacity for the country to answer to outbreak. And that's where the Global Fund grant is very interesting, because then through the Global Fund, we can also strengthen the system. And then this tool can really be impactful, if you want. So that's the take-home message I have. Thank you.
Mm-hmm. Thank you very much, Corinne. Christian, would you like to share your take-home message?
Yes, sure. Yes, I learned today, I know it a little bit before also, because Mr. Eibach and we talked, Sarah talked, that NTDs still have a high importance to the German government. And I can promise that, we from the German network, we will support and monitor this progress in One Health and NTDs ongoing, especially with now the presidency of the G7 of Germany, and we're really hoping forward that we can produce there some progress in fighting NTDs and implementing One Health. Thank you.
Thank you very much. I'd like to hand over to Laith. What is your take-home message?
Yeah, thank you, Kristina. I think I would highlight three different elements, to be honest. First, I would definitely emphasize on data. There's a transition today globally in data and in skillness. I mean, when we started 10 years ago, we barely could find field workers who are aware of certain software. Today, we can see them much more comfortable. So it means we need to emphasize on how we collect data at all levels, not only disease, but also the response that really inform policymakers. Second, I would definitely highlight engagement of stakeholders at early stage of any particular project. If you leave them late, then there's a likelihood of success. Here we learned from this project involving all entities at a time of the start. It really adds value. We see that there's a correlation of developing MOUs between meteorological entities and surveillance can only happen if you involve them at early stage, unlike other countries. And these are a very important source of information, missing in many cases. And my third element will be sharing experience. We definitely learned that by sharing experience across and between, benefiting really very much of how we take action, how we take response. There's a great differences between how Latin America perform from Far East Asia and Africa, because they all have different scope and level of surveillance, different burden. Carrying forward these messages definitely helps. So these my element: data, sharing experience, and also engaging stakeholders at early time. All the best with everyone. Thanks.
Thank you very much, Laith. And the last but not least, Daniel Eibach, what is your take-home message?
Yes, I think it was great to hear about this early warning systems and about the potential those tools have, and it was good to hear that we have actually those tools in our hands now, and we have massive amount of data. And I think the next steps are to standardize, harmonize the data, and also to share this data. And I think this is also discussions we are involved in, and which I will also bring forward, is that when we discuss the international pandemic treaty, because I think sharing of data is very important issue within this treaty and will be discussed. I think this is what we need also to prevent our next pandemic, to have internationally shared data available. Thank you.
Thank you very much. Thank you very much for summarizing the event and already in your take-home message. I would like to thank the panelists for taking time to share your experience with us today. It was a pleasure to have you. I would also like to highlight again, it was already shared in the chat, the policy brief that has been produced summarizing the EBAS tool and also the context in which it is or can be used. It's available also on the website of the Hub, and we will also share it subsequently with a recording of the event. I would like also to invite the audience before we end now to give us a short feedback by answering 5 questions in a quick evaluation. The link is also provided in the chat, or it has been just provided in the chat. It's good for us to learn and to improve. We need your feedback for this. And then I would also inform you and invite you also to our upcoming event, the Global Health Talk, that will take place on the 5th and 6th of July as a hybrid event in Berlin. The Global Health Talk is the big annual event of the Global Health Hub, and we want to bring together the members and also the partners of the Hub to discuss current global health issues and to engage also with representatives of the government. The 5th of July is the day that is open to everyone. It will be both on-site and also virtually available. And discussions will focus on climate change and health, global health architecture, and also we will look at the first outcomes of the G7 presidency after the first half of the year. And the second day, the 6th of July, is the community day dedicated to the vibrant communities of the Hub, such as the one that has contributed to today's event, the one on DNTDs. And yes, so we're happy to have you. You will receive the invitation very soon with more information and the registration link. And if you want to stay informed about the Hub, register as a member or register on the mailing list of the Hub. And then now we're finished. Thank you very much, Laith. Thank you, Corinne. Thank you, Daniel and Christian, dear participants. Thanks for having this fruitful information, for joining us today. I have learned quite a bit. And have a good day and stay healthy.